At the initial consultation, this provides us an opportunity to sit down with you and to find out why or look at some different causes for your infertility. We will ask questions and investigate a little bit further the answers that you've provided for us through filling out paperwork. And then we will ask you some questions and try to identify whether it may be an issue with producing sperm or inadequate amount of sperm, if there is potential with poor ovulation or not producing eggs each cycle, or if there's a concern or a problem that we find that potentially the egg and the sperm are not able to meet up. After we have come up with an idea of what potentially may be causing your infertility, we will then identify some additional testing that will either confirm this thought or the diagnosis, and then allow us to give you a plan in leading to you achieving a pregnancy. As far as diagnostic tests that will be performed at your first visit, they will be looking primarily at the three main categories for infertility. One would be male factor infertility, so we will perform a semen analysis that will specifically identify any risk factors that may put you as a couple at risk for male factor infertility. Other categories of infertility would be a inability for the sperm and the egg to meet together, so we will likely also order a hysterosalpingogram or HSG to evaluate the fallopian tubes, as well as perhaps a water ultrasound or a saline sonography to further evaluate the uterine cavity to ensure that an embryo can implant. And then we will also perform some additional blood work that will look at whether or not you're able to produce good high quality and high quantity of eggs. And as well as at your first visit, we will perform a pelvic ultrasound, which will allow us to further investigate your uterus and your ovaries. When we order a semen analysis, we are testing and looking for what is commonly referred to as a total motile sperm count. So we will look for the volume, the concentration of sperm, and then the percent of that sperm that is active or at least moving, which we refer to as motility. And then a fourth category that we will look at will be the size and shapes of the sperm, which is referenced as the morphology. Those four factors will allow us to be able to speak to whether or not the semen analysis or the sperm count is sufficient to help you as a couple to be able to achieve a pregnancy. The information that we will learn from the blood work that we obtain from you will help us to identify whether or not you are actually ovulating, and also what your ovarian reserve or the capacity for you to make eggs are each cycle. This will help us in identifying and coming up with a treatment plan specifically for you as a couple, and it will also help us to know the different types of medications that we will offer you. We will also look at some common labs that your obstetrician will order once you present to them, and if there are any abnormalities with any of the labs that we find, we will treat them prior to you becoming an obstetric patient, and thus delivering you to your OB in as healthy of a situation as possible. One of the categories of infertility is the inability of the egg and the sperm to meet together. One of the diagnostic tests that we will perform is called a hysterosalpingogram or an HSG. This allows us to place contrast into the uterus, specifically the uterine cavity, and then watch this contrast navigate or pass through the fallopian tubes. If we are able to demonstrate this, then we will have some assurity or some confidence in knowing that your sperm and the egg will be able to meet together and then lead to fertilization, and most likely then implantation within the uterus. During your first initial visit with us, we can offer a simple blood test which can identify over hundreds of different types of genetic disorders that you may be a carrier for. If we identify any types of abnormalities, we can discuss them further and discuss whether or not these will cause problems with future offspring.